in the case of treating Michael when I was here 6 months ago, and Michael will tell you the story together with Jess, but on my side, we are looking at the options. Is there any good options for Michael? There was. I see a face of Jess and Michael here. They were down here, looking at me, and they were asking a lot of things, hoping for a solution. And I went through the file, and I went back to Malaysia. I still tell myself, I should do something for them. Because my own father had liver problem. His only brother died of liver cancer. My 4 uncles from my mother's side, 3 of them died of liver cancer. And the one alive today is a hepatitis B carrier. And I'm the male son. I'm the only male part in that family. So can you imagine the risk of me getting liver cancer too is on a very high risk. So I take care of the liver very much. We all have to understand the liver can regenerate even if you cut away 90%. So that is the strongest organ. That's the reason why a lot of drinkers, they can still regenerate. They're still good, although they drink a lot. But the pancreas cannot take it. It's because the pancreas only have a lifespan of 50 to 55. So in the case of Michael, what we gave to Michael was going a bit off the conventional way of treating. Okay? We gave him the stem cells of the hepatocyte. It was a quad dose. I gave him a quad dose. I didn't give him a normal dose. A quad dose means a very strong dose, just like we will do for kidney patient, giving the renal cells. That's how we learn from treating CKD patients. Okay, we have many good records on all this, and we give him the spleen. We gave him GC-MEF, okay, to follow up. We give him thymus peptide to follow up. We give him super transfer factors to follow up. Okay, but the stem cells given for him was the liver, the thymus, a very strong dose of thymus, quad dose too. Okay, and we also gave him the spleen because the thymus work with the spleen very well. It's like a husband and wife. Okay, and along the way we did give him some other cells because he was moving to 50. Obviously, you are aging, so the other organs are coming down. You see, the whole body depends on the 12 system. It's not just on one organ or 2 organs. But anything to do with the liver will always affect the kidney. And it will affect the stomach. It will affect the pancreas. So in between, we have to look into all these organs. I'm so happy after 6 months, I meet Michael. Now, and it is their story to tell you now. Yeah. How are they feeling now? That is important. Because he comes from this center itself. It was referred from this center, Michael and Jess, please tell your story to them.
Hey everybody, privileged to be here. I'll just start off real quick, but I was in pretty bad shape before I met Dr. Chan, and I was getting some help, a lot of good help, but I feel like the treatments of the stem cells were life-changing, and I was going downhill pretty fast, and I was, didn't have much hope,
Michael, correct me if I'm wrong, but the doctor up north, they basically said you had a couple of months to live.
Yeah.
And when you came, I remember when you came here, I don't know if you were in a wheelchair, but you were close to it.
No, but I couldn't.
You could hardly, be mobile. And I know the clinic here. Pardon me?
What kind of cancer did you have?
I had colon cancer.
It's a genetic cancer, and so it had started as colon. It's a Lynch syndrome, SH2, and it was previously diagnosed 10 years ago. And they took the tumor out most of half his digestive tract, basically, and then it resurfaced again in his lymph nodes. And we had actually gone to Germany for treatment and took care of it then, but it kept coming back. And then 2 years ago, we don't know what happened, but something nosedived. And that's when the doctors up north told me to take him home to die. And
I'm trying to remember, they weren't sure what was going on in the liver though, right?
yeah, they all of a sudden, his liver and spleen freaked out. His bone marrow quit making red blood cells. His body was shutting down in ways they couldn't explain and didn't care. They were just like, well, we can't figure it out.
And they did biopsies and they were all inconclusive.
Yep.
Okay.
And so we, a friend of ours actually on January 1st called me, and on January 2nd, I drove us down here. And that's when we met Dr. Keneally, and game changer, because everything you guys do here is amazing, and it was bringing him back to life, but his liver was just pretty much giving up. They were classifying it as end stage, they were gonna start either putting him on the transplant list when we got a transfer up to Stanford. Things were still dicey, and that's when Dr. Keneally felt we needed to meet Dr. Chan. That's why they pushed us in here on that meeting, who we didn't realize was all you doctors, and we're like, what are we doing here? And like he said, he had to review the file. It was pretty dicey back then, but I'm grateful to Dr. Chan for saying, you know what, we gotta do this. So in July, we met with him, and he did the first initial transplant, hit hard, and within a few weeks we saw things starting to come back. He started feeling better. A month later they redid scans and they're going, huh, interesting. Okay, we thought you'd be a bit worse off. And we spoke with Dr. Chan and we did a secondary on the liver and the thymus.
And it was intramuscular injections?
Mm-hmm.
Deep intramuscular.
Yeah.
Yes, I am.
Yep. And that was in October, actually on his 50th birthday, October 18th. And then in December, he underwent more scans and blood work, and actually his routine colonoscopy, because with genetic colon cancer, it just keeps trying to come back there. And they couldn't believe it. His MEL score went from a 21 to a 12. And basically said, well, you are no longer in our radar for a transplant. And his liver had been misshapen on the first scan, and on the latest one was completely normalized. The spleen had been shutting down, completely normalized. And just everything is still on the up and up. Because of the genetic side of things, his body's still kind of throwing us things, but he's not going downhill. He's now going up the hill. So it's, I mean, I wouldn't have him if it wasn't for Dr. Keneally in the center and Dr. Ken. I mean, literally, we have a before and after picture.
That's remarkable. That's incredible.
Yay!